Hey, what's going on everybody? Welcome back to the channel. My name is Evan Venters, and today we're going to switch it up a little bit. I am actually an occupational therapist by trade, and today I wanted to talk to you about what exactly you should be doing for shoulder impingement. Now, I work here locally in Central Florida in an outpatient orthopedic clinic, and I primarily work with orthopedic shoulder, elbow, hands, and wrist injuries, and I have a lot of experience working with shoulders directly. So today we're going to talk about what is shoulder impingement, how do you get it, and how do you fix it. So let's first talk about what shoulder impingement is. Shoulder impingement is the pinching of the rotator cuff tendons in between two structures, that being the acromion process and the top of the head of the humerus. For those of you who don't know, the head of the humerus is the top of the ball and socket joint to the upper arm. Some other structures that are commonly involved within shoulder impingement include the bursa, which is a fluid-filled sac that sits in between two bony prominences, and also the biceps tendon, which is the insertion point of the biceps against the humerus. So in the clinic, it's very common to get patients with a diagnosis of shoulder pain or shoulder impingement. Shoulder impingement accounts for about 1/3 of all shoulder pain, and it's pretty easy to get rid of, but it can be time consuming and frustrating. So today's goal is I want to help you out, provide you with some tips and exercises that I found to be very helpful, and hopefully they can help you guys too. So shoulder impingement can be found in any body. Typically performing a repetitive forward motion over a longer period of time. Sometimes in athletes, they will get shoulder impingement. Anyone who spends time in a lot of forward motion, so playing baseball, football, swinging a club or racket. Also with elderly folks, they tend to get shoulder impingement because they get rounded shoulders and the glenohumeral joint is not in the proper position when they raise the arm up. Shoulder impingement is often characterized by a pinching sensation on the front of the shoulder and often can radiate down the side of the arm. It is normally found during flexion exercises as well as reaching out to the side. Research has shown that exercising alone and therapy for shoulder impingement is as effective, if not more effective, than other forms of treatment, including surgery and injections for corticosteroids. Before we dive into each exercise, I want to spend a minute going through things that you can do at home right now to help with these symptoms. The first thing you want to do is limit all repetitive forward motion of the shoulder. This includes raising the arm up, reaching out to the side, and performing tasks such as pushing a heavy cart or carrying an item out in front of you. Your overall goal right away is to get the inflammation down as much as possible. If that shoulder joint stays inflamed, your pain is likely going to remain. So try to limit a lot of repetitive forward motion activities. Use ice to get the inflammation down. If you're stuck in a position where you have to use your arms in a forward flexion plane, try to use your non-involved side or only use that arm in a pain-free arc of motion. Some people might be able to raise up to 90 degrees without any discomfort, but going past 90 degrees might be painful. So if you can carry something at 90 degrees or lower, it really can help limit pain and reduce inflammation in the long run. All right, so let's dive into each exercise. For these exercises, I suggest completing them 3 to 4 days per week, and I suggest trying them for about 4 to 6 weeks. After that point, if you do not have any success or relief of your symptoms, I definitely suggest seeking out help from a therapist, a physical therapist, occupational therapist, or seeking help from an orthopedic doctor. Okay, exercise number 1 is actually a stretch. So for this exercise, we are going to perform the cross arm stretch. And how we do this is we take our involved side, so this is going to be my right arm, and you're going to reach across your arm and simply pull with your non-involved side. This is going to stretch the posterior capsule of the shoulder, which is commonly found to be tight amongst those dealing with shoulder impingement. Simply hold this stretch for 30 seconds at a time. Keep the shoulder girdle down. Make sure you do not raise it up towards the ear. And you're going to do 3 of these. Stretch to a point of slight discomfort. Do not stretch to pain, as this is going to also contribute to your inflammation. So 3 sets of 30 seconds, just nice and easy, and then relax. For the next exercise, you're going to complete a pectoral stretch using the door frame. Now, a lot of times as we go through life, we spend so much time in forward motion. This doesn't necessarily have to be a throwing motion. It can be just simply spending time on the computer, holding items in front of us. A lot of times this leads to the shoulder blades rounding forward, thus causing a jam up in the front of the shoulder, also inhibition of the muscles in the backside of the shoulders. So something I definitely recommend is to do this door frame stretch. What you're gonna do is first find a similar door frame to this one, and you're gonna put your arms low, approximately at hip height. And you're gonna step through the door frame and keep the shoulders down and relaxed. Same thing for the other exercise. You're gonna hold for 30 seconds and complete this 3 times. Now, if you're not feeling this stretch as much, then what you can do is advance it and slide your arms up to approximately head height, and then step through the frame, and you should feel this stretch a little bit more, really here on the pectoral muscle in front of the shoulder. It is important to relax the shoulders, not hike them up towards the ears. Keep them down, and also do not arch your back. Keep your abdominals engaged, because we don't want to cause any back pain during this exercise. Now, when we're dealing with shoulder impingement, it's really a matter of muscle imbalances. A lot of times the anterior muscles on the shoulder become really tight and shortened, and the posterior muscles that lie in between these shoulder blades get inhibited, and they do not want to work like they're supposed to. Another issue is that the external rotators get really weak on the shoulder. Now, when you raise your arm up overhead, the humerus has to rotate outwards in order to effectively clear the glenohumeral joint. So in order to strengthen the external rotators, we're going to perform this next banded exercise. Now, to complete the external rotation shoulder exercise, you want to get yourself one of these therapy elastic bands. They're really cheap. You can get them on Amazon, or you can go to your local sporting goods store. Simply attach it to a door handle approximately between navel and chest height, and you're going to grab the band with your palm facing towards the ceiling. Then you're going to get a small kitchen towel and wedge it between your elbow and your torso. Simply stand beside the band and then rotate the band outwards away from your body. Make sure you keep your elbow in close towards your body, and you're keeping your shoulder blade back and squeeze together against the other one. Try not to let the shoulder that you're working on rotate forward, as this is going to inhibit the muscles that we want to actually activate. Now, it's very common for somebody dealing with shoulder impingement to have something called scapular dyskinesia or scapular winging. This is often caused by weakness of a muscle called the serratus anterior, and it can lead to shoulder impingement. Normally, when you raise your arms up and down, the shoulder blades need to rotate up and down as well in a symmetrical fashion. It is very common for the shoulder that has impingement to not move in a symmetrical fashion, thus indicating weakness in the serratus anterior. In order to strengthen this muscle, you're going to complete this banded serratus anterior punch for 3 sets of 10. So first thing you want to do is attach your band to a door handle or a post approximately at navel to chest height. You are then going to face outwards from the band and punch the arm outwards as if you were reaching for an item. Once you reach the end of your punch, you're then going to move your shoulder girdle forward a couple of more inches and then return it to its original position. Repeat this for 3 sets of 10. If you complete this exercise for 4 to 6 weeks and do not notice any change in the positioning of your shoulder blade, it is important to get this looked at by an orthopedic doctor, as it could indicate a potential problem with the long thoracic nerve. All right, so the last exercise is going to be one to strengthen the posterior muscles in between the shoulder blades. This is going to include the middle and lower trapezius muscles, as well as the rhomboid muscles. Now, earlier I talked about forward rounding of the shoulders, often caused by just poor posture over a long period of time, thus leading to inhibition of these posterior chain muscles. A lot of time, inhibition of these muscles causes dominance on the front side of the shoulders, and it can lead to shoulder impingement. A great exercise to target these muscles on the back side of the shoulder blades is to do what's called a prone lower trap raise. So in order to do this, you're going to get a mat or do this on your bed. You're going to lay down on your belly, Preferably put a towel or a pillow underneath your forehead so you're comfortable. And you're going to stick your arm straight out at a 45-degree angle. Next, you're going to stick your thumbs up towards the ceiling, and then you're going to lift the arms approximately 1 to 2 inches off of the ground, squeezing the shoulder blades together and then lowering them back down. Do not be surprised if this is difficult or more difficult than it may look like, because a lot of times these muscles are very often under conditioned and they're very weak. All right, guys, so there you have it. 5 top home exercises to help you treat shoulder impingement. Again, try these for about 4 to 6 weeks, and if you do not have any success or improvements in your symptoms, please reach out to your local PT or OT, or reach out to your orthopedic doctor and then see what the heck is going on. My name's Evan. Thanks for watching. If you're new here, subscribe to the channel, give this video a thumbs up, and we will see you guys in the next video. All right, later.